Next, we have Susan Brisendine from Bluebird Bio to talk to us about gene therapy treatment centers and support resources.
Wow, that's a lot to follow. Cynthia, thank you for your presentation. Really appreciate you sharing so vulnerably, and everyone here. Thank you very much for inviting us to speak today from Elisa and ALD Alliance to provide the community with an update on our gene therapy treatment centers and our support resources. My name is Susan Brisendine, and I'm on the patient advocacy team at Bluebird Bio, and I am now 4 weeks into my job. So I'm new to this job, I'm new to the company, I'm a new bird in the nest, as we'd say, but I'm really thrilled to be here. I've had a chance to meet some of you and talk to some of you and hear your stories, and they move me every time. And just thrilled to have the chance to learn from you. This day and a half has been just wonderful for me, so thank you. So what I'm going to talk about today is just an update on educational materials, an overview of our Qualified Treatment Center network, and information about my Bluebird support. And some of you may have seen a lot of this presentation already in a webinar in January that Elisa hosted. So this is just a slight update from that. And our slides are actually in this handout in your folder, so you don't need to take too many notes. I just want to point out I am not a healthcare provider, so I'm not here to give medical advice. This content is really for educational and background purposes only. So for those of you who don't know Bluebird Bio or don't know us so well, I'll just spend a couple minutes on this slide. We have our roots in the ALD community. Our mission really was to develop a gene therapy for ALD, for CALD. And that was our goal, that was our mission. And so we've spent 10 years working side by side with the ALD community, and you've been tremendous partners. It was amazing. We were so surprised to have that experience yesterday. We didn't know about that. We didn't know it was coming, but I don't think there was a dry eye. And it's just so wonderful to celebrate that with you, because it's largely because of you and all that you've done alongside us for 10 years. So thank you. A little bit more about our background in gene therapy. We've treated 180 plus patients with our gene therapies across different disease areas and 8 clinical trials. And that has equaled more than 500 patient years of experience with Bluebird Bio's gene therapies. As you probably know, we have 2 FDA approvals last year and 2 FDA advisory committee meetings that were unanimous votes, thumbs up. So we also have published more than 20 articles on our science and the value of gene therapy. So that's just a little snapshot of Bluebird Bio. We know that the community is eager to get an update on our qualified treatment centers. And for those of you who are not familiar with that term, qualified treatment centers, these are specialized hospitals that are trained especially to administer our Bluebird Bio gene therapies. And so our target was 5 qualified treatment centers so far, and 3 of them are now activated. And during this presentation, I kind of have like 3 late breakers, and this is one that star there, University of Minnesota, Fairview Health, was just activated last week. So really excited about that. So we have 3 treatment centers that are ready to treat and to receive patients. These qualified treatment centers are so important to be trained. They really play a critical role not only in administration of the therapy, but also manufacturing as they collect the patient cells that are used to make the therapy. But Bluebird Patient Services Program, which is called My Bluebird Support, or MBS for short, they can provide more information on the Qualified Treatment Center network, including, the latest updates. So that's always updated on a regular basis. So speaking of My Bluebird Support, this is a service that's designed to help families navigate the treatment journey. It's really designed to assist patients with seamlessly accessing our gene therapies. It offers personalized services and guidance through programs that cover education and insurance questions and treatment journey support. It also answers questions from doctors and qualified treatment centers regarding insurance coverage and enrolled patients and caregivers. It's led by a patient navigator who is a patient caregiver's main My Bluebird support point of contact. And these patient navigators are really knowledgeable about our process, about the gene therapy process, and they're designated support specialists who can help make use of My Bluebird support offered services. For patients and caregivers to discuss the program offerings with the patient navigators, they will need to enroll in My Bluebird support, but it's an optional program. Enrollment is not necessary. Upon enrollment, the patient navigator will conduct a benefits verification for you and will share the findings with the patient caregiver during their onboarding call. So this is just a great resource for you to be informed, to make an informed decision, and to advocate for what you need to, especially related to insurance coverage. So if you want to contact My Bluebird support, you can contact this 833-888-NEST. We're big on acronyms at Bluebird. It's open from 8 a.m. to 8 p.m. Monday through Friday, and you can also access the website as well for resources and information. Other resources available are our newborn screening toolkit, and we all know that Elisa and ALD Alliance, you are the experts on newborn screening. This is just a companion resource available to you if you're interested. And our other kind of late breaker is this new caregiver brochure and website that was just launched a couple weeks ago, which is another resource for you to get information about gene therapy. So these are QR codes, and for those of you who might be not quite comfortable with QR codes, I was really slow to understand them. I just want to assure you they're really easy. It's just like you're taking a picture on your phone. You point your device's camera at this QR code, a website address will come up, you click on it, and you can have access to these materials. So we have time for a few questions if you have them. I have another colleague in the room, Maloney. She's on our medical affairs team. You can say hi, Maloney. She's a medical science liaison, and so she's available to answer questions from healthcare providers. And I will do my best to answer your questions. Knowing I'm 4 weeks in, guys, I will do my best to answer them, or I will help you get the answers that you need. One last thing I wanted to share before we open up for any questions, if there are any, is we are so excited. I'm not sure, this is my third kind of late-breaking information, but if you haven't seen the announcement from the National Organization of Rare Disorders, or NORD, we have been honored, Bluebird Bio has been honored with a 2023 Rare Impact Industry Innovation Award. We're really excited about that. It's going to be celebrated during a ceremony, presented during a ceremony in May. But we recognize that this is the community's award as much as it is ours, having worked alongside us for all these years, committed and advocating for new treatments for CALD. So this award belongs to you as much as it does us, and I just wanted to say thank you. Thank you to the community, and congratulations. Can I answer any questions for you? I'll be here till about 2 o'clock today, so happy to hang around as well. Okay.
Hi, this is a question about access. So state-funded Medicaid programs do not pay for care outside of the state that they are funded by. How do you help families access this treatment if they have to travel to one of your centers?
Great question, and I would have to refer you to My Bluebird support. Those patient navigators are very skilled and ready to help you answer that question. I will tell you that everybody wants this to be covered, and we don't want it to be a cost-prohibiting factor. So they will work with you and help you advocate for what you need on an access basis. You're welcome.
Hello.
Hi. Thank you for your
That was really
presentation
loud.
yesterday.
Oh, thanks. I think many parents who are either here or watching obviously are really excited about the cutting edge technology of gene therapy. For me, just digesting the story that was just shared, I'm trying to put that in perspective and understand it. So I'm not sure that you'll have the answer, but how are we understanding that data around when gene therapy will be a better option versus traditional um, bo- stem cell transplant?
I understand the question, and I was thinking the same thing listening to the presentation. And I think following me, we have two providers who are administering gene therapy, and think they would be really glad to address that for you in their talk right after mine. Would you agree, Christy? Yes, thanks. So I think that the providers will get to that. But thank you for your question. Really grateful for the chance to talk to you about that today. Thanks for inviting us, Elisa.